Hello and welcome dear learners to the NPTEL course on Healthcare Quality Management, Infection Control and Patient Safety. In the Module 5, Operational Excellence in Healthcare for the Chapter 59 of Healthcare Quality Management Case Study 1, that is of NQAS National Quality Assurance Standards, we will be talking about a case study which is towards implementation of NQAS at a district hospital, that is ABCD in Maharashtra. The title is being given towards understanding the implementation of NQAS. Implementation of NQAS at a district level hospital. The name is anonymous actually for understanding the structure and the framework of NQAS and to give it more like how we need to proceed towards the assurance parts that NQAS has developed. Now, the overview of the case study we will be understanding. The district hospital ABCD as named is a 300-bedded secondary care facility service, a predominantly rural population in Maharashtra. The hospital faces challenges related to infection control, patient grievance handling, and inadequate support services. So you may come across to see that the hospital, this rural hospital particularly, have a lot of issues. To address this systematic gap, the hospital adopted an NQAS framework. The hospital adopted to take this National Quality Assurance Standards framework actually to meet up these challenges. Through structured gap analysis, capacity building, and process reengineering across the 8 NQAS concern areas, the hospital improved its internal assessment score from 46% to 84%, and that too within 18 months. So you may see that when they have adopted this public health facility has adopted this framework of NQAS, they have seen the remarkable change. Patient satisfaction rose from 68% to 89%, which has been seen as a trust building towards the hospital. And hospital acquired infection reduced by 32%, which was a very strong change actually which the hospital has observed. The hospital has achieved the NQAS certification entry level in 2024. So now we need to understand what is the background of the facility. The facility type is a district hospital and the location is in the ABCD district of Maharashtra. The bed strength is 300 bedded and the average OPD attendance is 1200 to 1500 patients per day. So you may understand that there is a too much or a good number of patients load in the OPD. The average IPD admissions are 250 to 300 per day. And the key services of this particular hospital is like emergency care, maternity services, medicine, surgery, diagnostics and blood bank. So you may see that a hospital has majorly all services actually which are necessary. The hospital catered to a high level patient load with limited infrastructure. And it has been for years that the hospital is doing this. So prior to adopting the NQAS adoption, the services were largely provider driven. It is more the provider driven services rather than the process driven. And with weak documentation and quality monitoring system, the hospital was coming with a lot of challenges. The challenges were more towards the patient expectations and the challenges were more towards the quality. Now, what is the problem statement? The problem statement is over here that the challenges which comes from understanding the baseline quarterly assessment which reveals the following quality gaps. The gaps were being seen as inadequate infection prevention practices. The gaps were being seen because of lack of hand hygiene audits which were not there and the biomedical waste segregation errors which were major. The second and very most important observation was low patient satisfaction. The patient were complaining about long waiting times and the poor grievance redressal which was not addressed. A weak support system was one which is fueling the issue, which was more because of the poor laundry, sanitation practices from housekeeping and biomedical waste management staff and equipment maintenance. Limited staff orientation to the standard procedure was not there. And poor documentation and monitoring of the key performance indicator was one which has been identified as a major gap actually into this, which made to see that there were issues with patient safety, issues with service efficiency, and public perceptions of the hospital was very poor. Now, what is NQAS over here coming as? And how has NQAS made a remarkable change into this? NQAS, which is being stated as National Quality Assurance Standard or framework developed by India's Ministry of Health and Family Welfare to assess and improve the quality of public health services in facilities like district, subdivisional, and primary health centers. These standards covering areas like patient rights, clinical care, and infection control help public health facilities self-evaluate and achieve certification. The certification can be platinum, gold, and silver for the better patient outcomes, which is very important. These are achieved through a standardized service delivery process, which is more towards improving the service and which are more towards identifying that the services needs to be very standardized. The approach is very patient-centered care. Measurable performance indicators are one which can be seen as improving towards the quality, and a continuous quality improvement cycle which gives a sustainability part. So NQAS was selected by this hospital because it aligned with the national priorities. It offered a formal certification, which is very important to motivate the hospitals to keep going into the quality cycle. And NQAS has emphasized system-based improvements rather than infrastructure-heavy reforms, which is sometimes very a rejected part actually when people really don't give a response towards quality is more because a lot of infrastructure reforms are being called upon. What is the methodology or implementation process that was adopted? The approach was formation of Quality Assurance Committee. Quality Assurance Committee gave a major move to the hospital and the appointment of Nodal Officer of Quality. Orienting the staff on NQA standards and checklist was done, and the baseline internal assessment team was being in action, and the action planning was taken. With the help of that, the baseline internal assessment was done. The gap analysis that has been come after this was that a structured gap analysis using the NQAS checklist identified the deviation across the department. All the departments, they have gone through the key tools which included service checklist, infection control audit, patient satisfaction survey, and KPI monitoring formats. This is very important to understand what are the services which are being given. Are they really aligned or are they really giving a benefit? Infection control audits actually to give more checks on the HAIs and even on improving actually the areas where which are seen to be seen as more towards the mortality part. Patient satisfaction survey, which is directly linked to understanding and building the trust of the patient towards the services, is very important way. And KPI monitoring format, which is more for the healthcare providers understanding and improving that sense of achievement towards them. So the findings were categorized into critical, major, and minor gaps. And the plan was a corrective action plan, that is called as CAP, which was developed after this gap analysis. Further moving into this case study, the intervention come across the 8 NQAS areas of concern, which is very important to be highlighted over here. When you have to think about NQAS, it are the important things that has to be highlighted is more like of the interventions. So in this particular case study actually which I want to focus is more like the first area of concern was the service provision. In this particular hospital, streamlined patient flow and signages in OPD and emergency was being seen. The intervention first was highlighted over here. Establish a triage and fast track queues were one among the second reason to be improved with respect to service provision. Introduction of referral and discharge protocols was one an improvement suggested. Patient rights are very important. The created patient charter display was in the local language, which is very important for the patient to understand what are the rights that they have. Implementation, grievance register and a grievance officer and a help desk was institutionalized. Ensured privacy screens and consent documentation, which is more towards a consent and confidentiality part of the patients. Then what are the inputs being given? Inventory mapping and minimum stock level system is very important, which was being seen as after the gap it was improved. Maintenance logbooks for equipment was ensured, and HR mapping and roster rationalization, which played a major role in revamping actually the hospital HR system. With respect to support services, color code biomedical waste management segregation was institutionalized. Outsourced mechanized laundry services was being seen as to see an implementation and working towards the plan of making more good contracts. And preventive maintenance schedules for the utilities were one which was very important to be seen to make changes more into the support services. With respect to clinical care, the clinical protocols for obstetric emergencies and sepsis management was done. Case sheet documentation standardization was one and major improvement to improve the clinical care. Regular clinical audit and mortality reviews were one which was making the staff and even the patient satisfaction to be seen more improved towards the clinical care. And very importantly for the quality, that is infection control, that functional infection control committee was institutionalized. All the HODs and the department head were one who were the part of that, from nursing to the top administrator, took a role actually to see the infection control committee to be institutionalized, which was more to be found functional with respect to hand hygiene stations and compliance audit, which they were making it more clearer and regular. Needle stick injury reporting system was made mandatory actually, which gives more chances to reduce the infection. The quality management part, monthly quality review meetings which were more made actually to see that the quality was a culture and a culture to be seen as regular. Department wise KPI dashboard were prepared and root cause analysis for sentinel events were done. And this is a way that this hospital has improved, and the outcome was monitoring of infection rate, readmission rates and waiting time were reduced. Integration of the patient feedback was for the service redesign and to improve the trust and ethical concerns that the patients were coming across. So what is the timeline and milestone that was followed? In the period wise, if we can see in first 2 months, the team formation, training based assessment was done. The key activity for the month 3 to 6 was gap closure activities and SOP development, which is to be seen as a very core and very important fundamental activities which is there. From month 7 to 12, internal assessment cycle, which was one which was improving actually the quality part to work on, and staff mentoring, which is very important, which was coming from the training. Month 13 to 16, external mentoring visit was done where the external came and gave an improvement actually towards improving the quality, and mock assessment was done which is giving more a level of examination actually that the team needs to go when the external auditors will come for the actual NQAS assessment. And month 17 to 18, final assessment and certification was done, which gave a major result that after 18 months, there was a remarkable change. What were the result? The result were on the performance outcome, the indicators, the baseline, percentage, and after NQAS implementation. The internal assessment score at the baseline level was 46% when they started. And what was the change in the 18 months? After the NQAS implementation, 84% internal assessment course was being seen. So you may see from 46 it drive to 84, and which is one a very remarkable change. From patient satisfaction point of view, it was that previously at the time of baseline it was 68% patient who were satisfied with the services, and it improved now to 89%, which is very closer actually towards achieving the maximum patient satisfaction. With respect to the very core component of quality, that is hospital acquired infection or healthcare associated infection, it was previously at a baseline it was 7.8% and it reduced actually to 5.3, which was not a bad but a very good improvement the hospital has seen. Biomedical waste compliance, which was very poor at, was being seen as 62% people, and now it is like 91%, which has improved actually, that the biomedical waste compliance was being seen. The average waiting time previously was much higher, that it was set 72%, which was reflecting toward dissatisfaction, and the patients waiting were more, and it has reduced now to 38 minutes. And 72 minutes to 38 minutes is a very good change over here, where you can see lot of patient satisfaction are more dealt only because of the OPD waiting. Now when we have seen these results and outcome, let me come up with the certification status. This particular hospital at NQAS entry level certification was awarded in the year 2024. The validity of this certification lies with 3 years with annual surveillance. And what were the quality feedbacks this hospital staff and the patient have given? One of the staff, the nursing superintendent, has said that NQAS help us shift from routine work to system based service delivery. and the roles are clearer now, and the audit has helped us to improve. So this was a very positive feedback which was given by the own staff, and the nursing superintendent was to be found as very helpful actually to understand that NQAS was benefiting them. From a patient side, we can see the patient has observed and stated that the hospital is cleaner now, the waiting time has reduced, and the staff behavior is much better now, which is giving you the more area of the perceptions of the patient towards the hospital. The expectations are more or less are met, and the patient has to be found very satisfying over here. Now, in the discussion and the lesson learned for the viewers is that the challenges the hospital face: resistance to change among the long tenure staff. The staff who were from more years actually in the hospital, they found to be resistant towards that. The hospital faced this, and the quality team also faced this challenge. Time constraints along the routine workload, because it was found that the NQAS workload was more, but it was resulting in a very good outcomes. Limited data management culture, which was to be found that the staff was not well versed actually to maintain the data, to have an issues actually with going ahead with the data maintenance was being seen. What are the mitigations? The mitigations were peer mentoring and on-job coaching, which was hand-holding, working with the staff, making it more clear, giving them accountability. Leadership advocacy was being seen as a major tool over here, that the leadership was very proactive actually to meet up and to make it more clear to the higher authorities of coming across for this NQAS journey. Incremental awareness and reward mechanism was to be seen as a best mitigation channel over here, and the lesson can be seen that it can give a great awareness towards the quality culture. What is the key success factor over here? Strong leadership commitment, active infection control committee, cross-departmental teamwork. And very important I find is like regular monitoring and feedback, which has been identified to be seen as very important to the sustainability part, where the strong leadership is making the culture visible of quality. And lastly, the sustainability measure which I want to utter over is like monthly internal audit, which gives you more the benefit in continuation part to this particular hospital. Continual KPI monitoring dashboard is one which can be seen as a visibility where the deficiencies can be curtailed and how you can move ahead for improving it more. Refresher training for the newer staff is very important when you come across actually that augmentation and inundations with respect to the training is very important more for the fresher staff or staff who has joined very new actually, versus to the one who have already know the system but make them understand about the KPI. Integrating of quality into routine review meeting is one a culture which has been developed, and this has one a step towards the sustainability. Now, in conclusion to this particular case study which we have discussed about a district hospital that is named as ABCD, the implementation of this hospital for the NQAS led to a significant improvement. Significant improvement in patient safety, service quality and institutional culture, which is uttering towards more towards sustainability. The framework established or enabled the structured quality governance. It empowered the staff towards ownership and enhanced the patient trust. The sustained monitoring and leadership commitment remain critical for long-term success, which is very important that when you have a sustained monitoring and your leadership is committed towards the culture, you may get a more benefit. So, at last, I would like to state that the implementation of the NQAS larger goal involves a comprehensive, multi-pronged strategy, which is led by the Ministry of Health and Family Welfare with the technical support from the National Health System Resource Center NHSRC, New Delhi. So with this, we come an end to this case study. Once discussion of NQAS, you can take the benefits of these references, which are more towards understanding of NQAS in detail, which the references are providing you about the information of the guidebooks, the checklist, and even towards making your public health facilities more aligned towards the requirement of NQAS. With this, I come an end to this chapter. Thank you, and thank you for the patience listening.